Hello everyone, myself Miss Nibha Soy from Chaitram College of Nursing. In this video, I'm going to talk about the use of magnesium sulfate in the management of eclampsia. So, before moving on to the topic, let's see what is preeclampsia and eclampsia. So, preeclampsia is a multiple system disorder of unknown etiology characterized by development of hypertension to the extent of 140-90 mm of Hg or more with proteinuria after 20th week of pregnancy in a previously normotensive and non-proteinuric woman. So these two manifestations, that is 140-90 mm of Hg and proteinuria, if these two clinical manifestation is complicated with convulsion or seizures, then the term is called as eclampsia. And in eclampsia, the drug of choice which is given to a mother is magnesium sulfate. So let's see what is the management of convulsion, what will be the antidote if there is any toxicity of giving this anticonvulsant, and what are the routes and the dosage given for this eclampsia patient. So when we have to administer this MgSo4, when a mother is coming with increased BP of more than 140-90 mm of Hg, and if she is having proteinuria, and this two condition is associated with tonic-clonic seizures or grand mal seizure, then we have to administer magnesium sulfate. Now moving on to the action of magnesium sulfate. So this magnesium sulfate is purely an anticonvulsant. How it acts? It decreases the presynaptic acetylcholine, decreases sensitivity of motor end plates to acetylcholine, and blocks the entry of calcium in the cell. So, firstly, decrease the release of acetylcholine from the motor end plates or the nerve terminals, so as there is no release of acetylcholine. This acetylcholine is neurotransmitter. It will not bind with the receptor at neuromuscular junction, and then the nerve impulses will not be transmitted, and hence it will decrease its sensitivity at the motor and plates. It also blocks the calcium. So what this calcium does? This calcium helps for the muscle contraction. So as it will block the entry of the calcium in the cell, the muscle contraction will voluntarily muscle contraction will be stopped. So these are the action of the magnesium sulfate. Now how we give this magnesium sulfate? The dosage or the regimen which is used is called as Pritchard regimen. So through this regimen we administer magnesium sulfate through IV and IM, that is intravenously, which is followed by IM. And there are two doses which is called as loading dose and the maintenance dose. So this loading dose is 4 gram of 20% intravenously is given over 15 to 20 minutes, and after that 10 gram of 50% of IM intramuscularly, that is 5 gram, 5 ampule in each buttocks is given, and after 4 hours of loading dose, this maintenance dose is given, that is 5 gram 50% 5 ampule in alternate buttocks is given. Now I will be telling you how to prepare this loading dose, that is how to prepare the loading dose. As we all know, this magnesium sulfate vial comes of 1 ampule contains 2 ml of 50% of magnesium sulfate, but as we have seen that in loading dose, we have to give 20% of magnesium sulfate, 4 gram of 20% of magnesium sulfate intravenously. Okay, so how we have to calculate it, or how we have to prepare this loading dose? Then 50% of this vial is of 50, suppose it is 50 gram of MgSo4 in 100 ml of NS, then 100 ml equals to 50 gram. Now we have to know that ये जो वायल है MgSo4 का, ये 2 ml का है, इसमें कितने ग्राम्स हैं. So we'll do cross multiplication. 100x is equal to 50 into 2. X will be 50 into 2 by 100, and after calculation it will come 1 gram. So X will be 1 gram. इसका ये मतलब है कि 1 ampule of this MgSo4 which contains 2 ml of 50% magnesium sulfate contains 1 gram of magnesium. 2 ml 1 gram. For 4 gram 4 ampule we have to take. 1 ampule is 2 ml, so 4 ampule will be 8 ml. तो ये जो 8 ml हम इसका लेंगे will be equal to 4 gram. Now in loading dose it is 20%, पर ये जो हम 8 ml 4 gram ले रहे हैं ये 50% है. Now how we have to make it 20%? Obviously when it is 50% और हमको इसको 20% करना है तो हमें इसे dilute करना पड़ेगा. So let's see how we have to dilute this 4 gram and how we have to make this 4 gram to 20% and which we have to give intravenously. So 20 by 100, like 20 gram of this magnesium sulfate, we will dilute it in 100 ml of NS and 4 gram हमको लगाना है जो कि आता है 8 ml में. अब हमको इस 8 ml को कितने में dilute करना है? So it will be, we have to find this Y. We have to do cross multiplication, then it will be 8 plus y into 20, which will be equal to 4 grams into 100. Then later on 8 plus y equals to 4 gram into 100 by 20, and after calculation it comes y will be equal to 4 into 5 means 20, and this 8 will come here. 20 minus 8 means y is 20 ml. 12 ml. So 12 ml of NS में हम मिलाएंगे 8 ml of MgSo4 to make it 20% of magnesium sulfate. We'll take 20 ml of syringe. हम इसमें 4 gram मतलब 8 ml. 4 ampule होगा 8 ml. हम डिसॉल्व करेंगे 12 ml of NS में जो कि बन जाएगा 20 ml. And it will be equal to 20% of MgSo4 and we'll give it slowly intravenously over 15 to 20 minutes. After that, we'll give maintenance dose which is 5 gram in right buttock and 5 gram in left buttock intramuscularly, and we are not supposed to dilute it in anything because we have to give 50% of this maintenance dose directly intramuscularly. Okay. As we are giving this magnesium sulfate, maybe there is chances of toxicity, so we have to observe for some of the things, that is knee jerk and patellar reflex. We have to check the mother is having or the patient is having proper knee jerk or patellar reflex before administering the maintenance dose. Her respiration should not be less than 12 breaths per minute, or her urine output should not be less than 30 ml per hour, or less than 100 ml per 4 hour. So if these three observations are positive, means the patient is having or the mother is having magnesium sulfate toxicity. At that case, we have to stop giving maintenance dose and we have to resolve the toxicity, and the antidote which is given to resolve the toxicity is calcium gluconate. So what is how this calcium gluconate is available? This is available in 10 ml vial, 10% concentration, and it contains 1 gram, and we have to give it over 10 minutes slowly. Okay, so antidote which is given to relieve the toxicity and toxicity of the magnesium sulfate is calcium gluconate. Thank you, dear students.